A 52-year-old woman walks into the emergency room insisting she is dead. Not sick, not in pain. Dead. She calmly tells the staff, "My heart doesn't beat. My organs are gone. Please, stop wasting resources on me." Her name is Margaret Lewis, a soft-spoken librarian who just weeks ago lived an ordinary life. But tonight, she stares at the doctors with hollow certainty, claiming she has no blood, no stomach, no life left inside her. The medical team is stunned. Patients with chest pain, seizures, and strokes they know how to handle. But what do you do when a patient insists she's already a corpse? Within hours, her younger sister, Helen, rushes in. Unlike the doctors, Helen doesn't look alarmed. She looks annoyed. "She's been like this before," Helen whispers to the nurse. "Ever since we were kids, Margaret always found ways to draw attention. If it wasn't fainting spells, it was dramatic stories. I think she's exaggerating again." For a moment, even the doctors pause. Could this really just be an act? A desperate play for sympathy? But as the hours pass, the mystery deepens. Margaret refuses food, saying the dead don't need to eat. She pushes away 4 lines, insisting her veins are dust. She even begs to be transferred to the morgue, to rest where she belongs. Helen watches, arms crossed, her doubt slowly wavering. The conviction in her sister's eyes isn't the performance of a drama queen. It's something darker, something real. The doctors begin running tests. Vital signs, normal. Blood work, perfect. Brain scan, clear. Physically, Margaret is healthy. And yet, she insists she has no pulse, no organs, no life. That's when a psychiatrist is called in. After long interviews and psychological testing, the answer emerges. Cotard's syndrome. Cotard's syndrome, often called walking corpse syndrome, is one of the rarest psychiatric conditions in the world. Patients believe they are dead, missing organs, or that their body has decayed. It often appears after severe depression, trauma, or neurological damage. In Margaret's case, doctors suspect a mix of untreated depression and a recent bout of encephalitis triggered the delusion. The terrifying part? Many Cotard's patients refuse food or medical care, because why would the dead need to live? Left untreated, it can be fatal. Margaret is admitted to intensive psychiatric care. Electroconvulsive therapy and medication slowly begin to chip away at her delusion. Helen visits her daily, at first still skeptical. But over time, as she watches her sister slowly return, eating again, speaking again, acknowledging that she is alive, Helen's doubt transforms into guilt. She realizes Margaret wasn't faking. She was fighting a rare, nightmarish illness no one in the family had ever imagined. Margaret eventually regained her sense of self, but cases like hers remind doctors how fragile the boundary between mind and body can be. This isn't fiction. Cotard's syndrome is real, and Margaret's story is based on a true medical case.